My name is Dr. Holland. I'm the Medical Director of Stroke and Neuroscience at Monmouth Medical Center. And I want to take a few minutes to talk to you about transient ischemic attacks and the important steps that need to be taken to evaluate a patient who has experienced a transient ischemic attack in order to prevent the development of stroke, as well as a new outpatient evaluation center that we've started at Monmouth to facilitate this. So most of you have probably heard of stroke. Stroke is the third leading cause of death in the USA right now, and it's already the leading cause of disability, with more than a quarter of stroke survivors requiring admission to a long-term care facility like a nursing home. You may have also heard about new clot-busting treatment for stroke. Unfortunately, even with these treatments, the outcome is less than ideal, and less than half of patients treated, even with these new cutting-edge methods, make a good functional outcome. By good functional outcome, I mean returning to work or taking care of themselves. So we need to be preventing stroke more effectively, since our treatments are less than satisfactory, and we need to look for strategies to identify patients who are high risk for stroke, make interventions, and prevent them from getting disabled as a result of a stroke. And the question is how best to do this. Now, you may be less familiar with the concept of TIA. A TIA, or a transient ischemic attack, is a stroke-like episode that resolves on its own within 24 hours. And it turns out that many patients who present with a major stroke, in fact, report having had a recent preceding TIA, perhaps a week or two before that, and this may turn out to be a warning that a major stroke is on its way. So these patients presenting with TIAs really need aggressive stroke risk factor evaluation and intervention quickly and efficiently if we're going to try and prevent them from having a stroke in the subsequent few weeks. So these are the patients that we need to target and evaluate quickly. So if you've had a recent TIA, what can we do to prevent you from having a major stroke? Well, the first thing is something as simple as starting an aspirin every day. That's been shown to lower the stroke risk in people who have had TIAs. In addition, we want to screen TIA patients and for high blood pressure, high cholesterol, diabetes, and smoking. And if these risk factors are present, make sure that they're being treated. We want to screen these patients for narrowing or blockage of the carotid arteries and consider surgery for appropriate cases. And we want to screen TIA patients for the presence of an irregular heart rhythm, atrial fibrillation, and if found, consider blood thinners. And all of these interventions have been shown to reduce the risk of stroke in patients presenting with TIA. Now, obviously, we're not the only center in the USA to recognize the importance of evaluating TIA patients to prevent stroke. What we're proposing is a different model, a different venue for doing this. Right now, most patients with TIA come to the emergency room and they're admitted to the hospital to get their evaluation done as an inpatient. The problem is this is actually a relatively inefficient way of doing this, and TIA patients spend an average of 3.5 days in the hospital getting their test done and seeing their physicians, and that costs Medicare or their insurance company about $3,000 over and above what it would cost to do these tests as an outpatient. Now, what we're proposing at Monmouth is an open access clinic for the expedited outpatient evaluation for these stroke risk factors and stroke prevention for patients who have had a recent TIA. And what we're hoping to do is get the patients into our center, get this testing done, figure out what the stroke risk factors are, and make interventions as an outpatient in an expedited manner without having to have the patient stay overnight in the hospital. And we're calling this the TIA Rapid Evaluation Center, or TREC. Now, we've made arrangements that for every patient who comes to our center to get all these tests done in an expedited manner. And this includes vital signs, blood work for lipid panel, an EKG, an echocardiogram, a carotid study, an MRI of the brain, and a visit with the stroke neurologist, as well as stroke prevention education. including smoking cessation and discussion of other risk factors. Depending on how these tests come out, selected patients will get additional imaging studies of the carotids, perhaps with a CTA, if necessary a consultation with a vascular surgeon or a cardiologist, and they'll be started on medication which may be antiplatelet agents, blood pressure medicines, cholesterol agents, or even blood thinners depending on their specific circumstances. We really want to be focusing on patients who've had a recent TIA, and by recent I mean within the last 2 weeks, because these are the patients who are highest risk for getting a stroke, and we want to be seeing all the patients who have had a recent TIA within the last 2 weeks who either present to their doctor's office or to the emergency room. Then in the next morning's open access TREC clinic. Okay, this clinic is going to be available every day, Monday through Friday, as needed. We're going to get patients seen no matter how many and get them evaluated quickly to prevent them from getting strokes. Now, this type of clinic may be new to the United States, but it's already been tried and tested in other countries, mostly in Europe, and this is actually data from Oxfordshire in England showing the incidence of recurrent stroke in patients who present with TIA for those patients evaluated in this kind of open access expedited outpatient setting or TREC versus patients evaluated by more conventional means. And you can see that the incidence of stroke is markedly reduced in patients evaluated in the TREC-like setting, and this data showed that the 90-day stroke risk fell from what was expected to be about 10% down to about 2%. That's an 80% reduction in stroke simply by instituting this kind of rapid evaluation center. So just to summarize, what we're hoping to provide here with this service is a one-stop shop for stroke prevention in patients who present with a recent TIA. Patients will come to the center the next morning after their event or the next morning after they're seen by their doctor. They'll get all the testing done that morning and they'll leave the center with a diagnosis and a plan for stroke prevention, all based on evidence-based guidelines. Not only that, but we'll register these patients and follow them so we can collect outcome data, make sure we're doing the right thing in terms of stroke prevention, and arrange for any necessary future education, support, or other interventions, all aimed at minimizing their long-term stroke risk. So we think this is a pretty exciting program. We hope that you'll support it, you'll tell your friends about it, and I thank you for your attention, and I urge you to check back to our website frequently, because as part of our new Monmouth Neuroscience Institute, we're opening a bunch of new programs over the next 6 to 12 months that may be of interest to you.